Hi, everybody. My name is Jake Tones, and I'll be presenting to you my proposed study for Research Applications 1 and 2, taught by Dr. Rob Balogh. The proposed study will analyze individuals with osteoarthritis and osteoporosis through the treatment of resistance training paired with nonsteroidal anti-inflammatory drugs, NSAIDs, selective androgen receptor modulators, SARMs, or anabolic steroids. This presentation will lead the viewer in understanding the presented conditions and how it affects daily living, the objective of the research and how it will be conducted, the methodology used to test the hypotheses, how the data will be measured in order to be interpreted, the ethical standards of practice to be followed, and the acknowledgement of gaps in the proposed study. Lastly, references will be provided as supportive literature. The following question will be addressed in the proposed study. How do NSAIDs, SARMs, and anabolic steroids compare in improving joint function, pain perception, daily task performance, and overall quality of life in individuals with osteoarthritis and osteoporosis undergoing a structured resistance training program? Osteoarthritis is a highly prevalent condition amongst individuals 45 and over, involving the breakdown of cartilage and bone tissue, causing pain, and contributes to the growing burden of musculoskeletal disorders globally. Osteoporosis is a metabolic bone disease that weakens bones, increasing fracture risk. It can develop undetected until a medical incident, causing significant medical consequences. It is the leading cause of disability in older adults. Both conditions can initially be treated through diet and lifestyle changes, losing weight, and an appropriate medication for the individual. The American College of Sports Medicine defines resistance training as a form of physical activity that is designed to improve muscular fitness by exercising a muscle or muscle group against external resistance. Latham and Liu found that strength conditioning and training is beneficial to older people with osteoarthritis, showing significant improvements in strength and function and reductions in pain in older adults. The proposed study will be guided by the following healthcare professions and their governing bodies. Physiotherapy is a key treatment that improves mobility, function, and overall well-being through rehabilitation, injury prevention, and fitness. It helps manage pain, supports recovery from surgery, and aids in treating injuries and chronic conditions. In Ontario, physiotherapy is regulated by the College of Physiotherapists of Ontario to ensure safe, competent, and ethical care, requiring all practitioners to be registered. Rheumatology focuses on diagnosing and treating rheumatic diseases, including arthritis, autoimmune disease, and musculoskeletal disorders. The Canadian Rheumatology Association represents over 600 members nationwide, promoting excellence in arthritis and rheumatic disease care, education, and research through networking, training, and funding initiatives while fostering collaboration and advancing the field of rheumatology. Endocrinology and metabolism focuses on diagnosing and treating disorders of the endocrine glands, hormone systems, and metabolism. The Canadian Society of Endocrinology and Metabolism promotes excellence in research, education, and patient care, and sets certification standards with the Royal College of Physicians and Surgeons of Canada. Pharmacology is the study of how drugs affect biological systems, encompassing their mechanisms of action, properties, and effects on the body, while integrating principles from chemistry, biology, and medicine to inform drug design, development, and therapeutic use. The Canadian Society of Pharmacology and Therapeutics is a national not-for-profit organization focused on advancing drug discovery and therapeutic choice through education and research, supporting clinical pharmacology training, and fostering academic research in Canada. CSPT is the Canadian member of the International Union of Basic and Clinical Pharmacology, and a chapter of the American Society for Pharmacology and Experimental Therapeutics. This study is important as NSAIDs, while effective for joint pain, carry long-term risks such as gastrointestinal and cardiovascular issues. Anabolic steroids may offer benefits but are stigmatized, limiting their use. And although SARMs have been shown to prevent bone loss and increase muscle mass in animal models, their clinical validation for arthritis and osteoporosis is still lacking. There is also no direct clinical comparison of these treatments, making this study crucial for exploring safer, more effective treatment options for musculoskeletal conditions. Past literature. A retrospective study was conducted from 2013 to 2017 in Japan amongst 370,000 hospital osteoarthritic patients taking transdermal NSAIDs and pain medications for back pain. The study was conducted to understand prescription patterns for patients with osteoarthritis and the risks of long-term NSAID use. NSAIDs were advised to not be used long-term due to adverse events like gastrointestinal disorder, kidney failure, and cardiovascular disease. The study did identify its limitations and gaps, having only used data from hospitals that provided acute care and didn't include patients from smaller clinics. And the data was used only from hospitalized patients, thus excluding more generalized populations with milder symptoms. This study is a strong case for understanding NSAID use due to its large sample size and insight into medication prescription of NSAIDs for osteoarthritic patients. Another study was focused on regarding SARMs. A 3-month double-blind placebo study was conducted, consisting of 120 elderly men and postmenopausal women. They were tested for the effects of a SARMs medication on muscle wasting, physical function, and metabolic health. This study was done to explore potential treatment of muscle wasting that didn't involve testosterone replacement therapy or anabolic steroids. While the study included both men and women for a gender-based comparison and had multiple health parameters being monitored for safety, the short time period of the study did not conclude any long-term positive or negative effects. The study also recognized improvements in insulin resistance, but was not the focus and could have been beneficial for a diabetic demographic. This study is evidence of a need to study the treatment for a longer period of time and the possibility of being an alternative to anabolic steroids. The third study, focusing on anabolic steroids, was a prospective, double-blind study conducted on patients undergoing a total knee replacement surgery with signs of osteoarthritis. The control group received a placebo saline injection, while the test group received a small dose of an anabolic steroid. The study was conducted to test the potential of the anabolic steroid nandrolone and the possibility of accelerating recovery post-surgery. While this study was methodically well done by being randomized, double-blinded, and used a placebo, the study was identified as a pilot project, signifying the early stages of the research knowledge. The study also only consisted of 5 patients in each group and did not reflect real-world administration of the drug to a general population. This study aligns with the proposed use of anabolic steroids within healthcare situations and highlights a need for research to be done on a larger scale. The studies by Akazawa, Dalton, or Holman have focused on a single treatment approach or specific outcomes, such as muscle strength or function, and don't provide comparisons of multiple treatment options for osteoarthritis or osteoporosis, nor do they emphasize pain management or quality of life as primary measures. A proposed study comparing NSAIDs, SARMs, and anabolic steroids would fill these gaps by offering a direct comparison between these treatments and assessing their impact on joint function and pain, muscle mass, physical function, and quality of life in osteoarthritis or osteoporosis patients, which is currently missing in these studies. This proposed research could make an important contribution to healthcare by providing valuable insights into the relative effectiveness of different treatments for osteoarthritis and osteoporosis, expanding therapeutic options. The knowledge gained could help shape future clinical practice and break stigma of muscle-building drugs, offering more effective and personalized treatment strategies for the arthritis and osteoporosis community. The objectives of the study are to evaluate the combination of resistance training with NSAIDs, NSAIDs and SARMs, or NSAIDs and anabolic steroids, and their impact on joint function, mobility, pain perception, and overall quality of life in patients with osteoarthritis or osteoporosis. The study will determine if NSAIDs interfere with the benefits of resistance training and assess the feasibility of SARMs as an alternative to anabolic steroids for improving joint and bone health. The secondary objectives of the study will explore combining medication treatments and create a better understanding of anabolic steroids, thus reducing stigma. Methods and study design. A prospective randomized controlled trial will be used to compare NSAIDs alone versus NSAIDs combined with anabolic steroids or SARMs. Methods and participants. Inclusion criteria. The study will recruit participants aged 45 to 65 years old with osteoarthritis or osteoporosis currently taking NSAIDs for at least 3 months. Participants will need to be able to perform basic weight-bearing exercises with modifications if needed, and agree to a 2-year participation and attend at least 80% of the training sessions. Participants will need regular in-person access to registered physiotherapists. The registered physiotherapists will follow the evidence-informed practice standard, controlled acts and restricted activities standard, and collaborative care standard stated in the Standards of Practice by the College of Physiotherapists of Ontario. This will guarantee safe and proper administration of collaborative, complementary, and emerging treatment. Lastly, the participant's lifestyle will need to not be physically strenuous due to ensure activities of daily living or work occupation interfere with daily pain management. The exclusion criteria. Participants not being recruited will be individuals that have any contraindications to any of the 3 medications being offered, like cardiovascular disease, hormone-sensitive cancers or therapies, including testosterone replacement, metabolic concerns, or recent surgeries. The research team will comply with the rules and standards of College of Physiotherapists of Ontario, the Canadian Rheumatology Association, the Canadian Society of Endocrinology and Metabolism, and the Canadian Society of Pharmacology and Therapeutics. All healthcare professionals will follow the Tri-Council Policy Statement, Ethical Conduct for Research Involving Humans, TCPS2. The research team will recruit participants through local healthcare settings, community health programs, and physician referrals where interested participants will be informed of the opportunity to participate and be provided a questionnaire to determine recruitment eligibility. The focused exposure variables will be 2 randomized groups of participants where the individuals will receive one of 2 treatments, nonsteroidal anti-inflammatory drugs, NSAIDs, and selective androgen receptor modulators, SARMs, or nonsteroidal anti-inflammatory drugs and anabolic steroids. The control variable group will only be prescribed nonsteroidal anti-inflammatory drugs. All 3 groups are considered categorical variables. All 3 groups will participate in resistance training for 2 years. The first year will involve a baseline of conditioning to resistance training, as well as NSAID medication, which will be monitored. The second year will involve the randomized exposure variables mentioned earlier. Measuring the outcome. The main outcome variables for this study will focus on joint function, pain management, and muscle and bone health. These outcomes will be assessed using clinically validated tools such as Visual Analog Scale, Western Ontario and McMaster Arthritis Index Pain Scale, WOMAC, and DEXA bone density scans, with additional measurements including range of motion. Quality of life will be measured by a 36 short-form health survey. Secondary outcomes will measure bioelectrical impedance analysis tests for lean muscle mass to better compare SARMs and anabolic steroids. These outcome variables will give us a comprehensive understanding of the combined effects of NSAIDs, SARMs, and anabolic steroids when paired with structured resistance training for individuals with osteoarthritis and osteoporosis. Statistics and crunching the numbers. This study will use both descriptive and inferential statistics to analyze the data. Descriptive analysis will summarize baseline characteristics using means, standard deviations, and frequencies to ensure the groups are comparable. Inferential analysis will include ANOVA or mixed effects models to track changes in perception, joint function, and muscle mass over time. The quantitative data will be collected by an intra-observer for consistency. The qualitative data will be collected by inter-observers due to different interpretations of questionnaires. Significance will be determined using p-values and confidence intervals to assess the impact of each interval pre and post-treatment, and a two-sided t-test will be used to determine the mean differences in the outcomes measured between the two treatment groups, NSAIDs alone versus the combination treatments. The hypotheses. The hypotheses of the research will be the following. Null, there is no significant difference in pain perception, joint function, or lean muscle mass between the different treatment groups. The alternative is there is a significant difference in pain perception, joint function, or lean muscle mass between at least two treatment groups, NSAIDs versus NSAIDs and anabolic steroids, NSAIDs versus NSAIDs and SARMs, NSAIDs and anabolic steroids versus NSAIDs and SARMs. The study will adhere to ethical guidelines outlined by the Tri-Council Policy Statement and relevant professional organizations, including the College of Physiotherapists of Ontario. The study will provide informed consent and an understanding that participants have the right to withdraw at any time. The research will be prioritizing participants' well-being through ongoing monitoring and minimizing risks, and ensuring fair recruitment and equitable access to the study for all eligible participants. The study will be province-wide and available to varying demographics in gender, culture, language, and abilities. Limitations of the research. The following challenges for this study were identified. Recruitment and adherence to the program. The challenge, recruiting enough participants willing to adhere to the resistance training program. The strategy, recruiters will focus on suburban areas, offer flexible schedules, and communicate benefits clearly. Recruiters will use regular check-ins, motivational interviewing, and track progress to encourage adherence. Medical barriers like gastrointestinal issues or hormonal imbalances. Challenge, health conditions may affect participant continuity. Strategy, the research team will have close monitoring by endocrinologists, rheumatologists, and clinical pharmacologists who will adjust treatments or medications as needed. Physical limitations due to osteoarthritis and osteoporosis. Challenges, participants may have advanced physical limitations. Strategy, the research team can customize resistance training programs and regularly assess abilities to ensure exercises are appropriate. Summary. In conclusion, this research proposal has the potential to significantly improve healthcare practices, resource allocation, and quality of life for individuals with chronic conditions like osteoarthritis and osteoporosis. By integrating resistance training with NSAIDs, SARMs, and anabolic steroids, the study seeks to enhance pain management, joint health, functional capacity, and improve overall quality of life, offering valuable alternatives to conventional treatments. It strengthens the evidence for resistance training, improving physical function, challenges the stigma around anabolic steroid use in medical settings, and contributes valuable data on SARMs as a potential therapeutic option. Moreover, it highlights the potential of combining NSAIDs with other drugs and resistance training for better pain management. This research can influence future studies, funding allocation, and healthcare policy, paving the way for comprehensive pain management and rehabilitation strategies. Ultimately, it aims to improve patient outcomes, shift perceptions, and enhance the overall quality of life for individuals with these chronic conditions. This concludes the presentation. Thank you for listening. Please feel free to investigate any of the listed references to further your understanding and interest of the related topics.